Well, a warm welcome to this talk, and I'm delighted to welcome Dr. Vibeke Manniche, who's a doctoral researcher in Denmark. Welcome, Vibeke. Thank you for coming on.
Thank you very much, and thank you for being on your show. Thank you.
Now, we basically want to discuss your quite fascinating paper relating to different batches of the Pfizer vaccine.
Yes.
And we can see the paper that we're discussing here on the screen. The key thing about this paper is you've divided these vaccines, as I understand it, into different batch groups. And when we look at the batch groups, we see a remarkably different profile of side effects.
Yes.
So up here we've got the suspected adverse reactions. So this is increasing adverse reactions up here.
Yes.
So as we go up, we're getting more adverse reactions.
Yes.
And along here we're correlating the number of vaccines per dose.
Exactly.
So if you could explain this graphic to us, Vibeke, and the significance of it.
Well, the thing is, it's officially data, so to speak. It's data which is the official data. So we've just looked at the data and tried to figure out if the reported side effects, because these are only the reported, which is maybe, the top of the iceberg. So we looked at those and very quickly found that some batches seem to have many more reported side effects than other batches. So we made this and made a cluster analysis on it and, different statistic work on it. And then we found out that, yes, literally some of the batches, which is actually only 4.2% of the batches, are associated with almost 71% of the reported side effects, which means that if literally you would usually expect that if the batches were the same quality, the product the same, or the product line, whatever, you would expect more or less the same amount of side effects, maybe a little difference, but this is like a huge difference between the batches. And so, it's a safety signal, really.
So 4.2%
yes.
of the batches accounted for 71% of the side effects.
Yes, of the reported side effects.
The reported adverse reactions, yeah.
Yes.
If you take us through this blue grouping, first of all, with the highest incidence of adverse reactions, alarmingly high
yes.
Adverse reactions.
Yes, I mean, the thing is, these side effects, adverse reactions, everything from, you have death in it, but you also have like myocarditis, you have tinnitus, you have soreness, you have redness. I mean, this is a bunch of side effects, some being less serious and other being more serious. And the thing is, which we didn't know when we had the study out, because we couldn't have the information, but we had it later on, is that these batches, the blue batches, seems actually to be the batches given for the citizens in the beginning of the vaccination, and therefore, of course, some would say, well, that was the elderly and the fragile, but that's not the case, because actually we know that 21% of the one in the blue group, or who had those batches, only 21% were older than 70, while actually in the yellow line, which is in the lowest one, that number was about 27%. So the thing is, it's not the explanation is not that it was the elderly or the fragile, because literally mainly those vaccines were given to frontline health personnel. So it just shows that for some odd reason there was many more reported side effects for very few batches. And then we go to the green group, where there's kind of and obviously and statistically also much less side effects reported. And then we end up with the yellow one, which is in the bottom, where, as you can see, there's hardly any side effects reported, or you can even say none.
So the blue batches, they were given early on in the pandemic.
They were giving when we started to vaccinate, which was in, January, February, March 2021. Yeah.
Yeah. So that they were early on, but it included
Yeah.
the elderly who were vulnerable and healthcare workers who were young.
Yes, and actually the distribution of age, older than 70 is actually the same between all three
Yeah.
groups, even a little more in the green and a little more also in the yellow. So because I see the discussion, this has gone viral, especially the last, 2 weeks. And I see the discussion that someone will say, well, that's just because it was the elderly and fragile, but that's not the case.
Now, was the green batch sequentially, temporarily after the blue batch? Are we looking at like the blue first and then the green given out next and then the
Yes.
yellow given out last? Is that the kind of order it's
Yes,
going in?
more or less, more or less. There
More or
seems to
less.
be, I mean, the thing is, again, what we have in the study, we don't have the dates because they didn't want to give us the date. They have
Right.
done that afterwards. So it's not in the study. We would have loved to have it in the study
Yeah.
because we were eager to get these data, but they wouldn't let us have it. They've got now. So yes, it seems like there's a historical or a time frame in it. So it's kind of, and that's also why you can say that why we have the yellow line, that there could be several explanations for that. One, which is a good explanation, is that some of the data was in a backlog. So actually, when we had those data, some of the data hasn't been processed yet. So we have afterward got the data, a new, pair of data, and it seems that some of the yellow ones has, got into the system. So that could also be part of the explanation, but it's not doing anything about the blue and the green,
Yeah.
which is literally the most varying part, so to speak.
So it could be that a few adverse reactions for the yellow groupings do appear.
A little more, yes,
A few.
a few more because there's a backlog. So we got
Yeah.
it from a date, till another date, and
Yeah.
if they hadn't, processed those data, then they wouldn't go into that. But it's just a little difference. It doesn't explain the big difference from especially the blue and the green line.
Yeah. But we can say with some level of certainty that the blue vaccines were given before the green and the yellow vaccines.
Yes. And that is the question we are raising, because I think this study raises safety signal, but it also raises a question in this regard, Pfizer, whether they changed the batches, whether they changed the product, whether they changed, the ingredients, the transportation. We know that they changed the cold chain. They changed that procedure. In the beginning, it had to be minus 70 degrees. Kept minus 70 degrees, and suddenly that demand just disappeared. So I think what is the main thing about this study is that it raises questions to Pfizer.
Right. Let's ask this question clearly to Pfizer.
Yeah.
Were these blue doses formulated
Yes.
in a different way to the green and the yellow doses?
Exactly.
Because has the product changed?
Exactly. Has the product changed? When did it change? When did it change, and why did it change? I think that is the proper questions. I mean, the authorities, like the medical agencies, and that they should definitely ask these questions. The regulators, but also the politicians, who were so eager to have the population vaccine and so on, and took away some liabilities issues also. I think we all need to have an answer to these questions, because you kind of, how was the informed consent? If someone came, a young doctor, 35 years old, and they would say, well, listen, you're going to have the blue one, you're going to have that one, which we know is going to be full of side effects, so take care out there, or you're going to have that one without no side effects. I mean, since there seems to be such a big difference, the question is, or I may come with the answer, is that the population was not they didn't have the proper information to literally give an informed consent.
This is outrageous. Why were we not informed in early 2021 about these horrendous levels of side effects and adverse reactions, as indicated by these blue batches. Why were we not told about this?
I don't have the answer.
No.
What I ask also is, why didn't the medical agencies, why didn't the people who were supposed to look after these safety signals, why didn't they wake up, so to speak? Why didn't they? Because these are data which is actually there. So it's not data we have been, find here, there, and everywhere. It's actually data where the, people in charge should have looked into these data. That's why you have the surveillance. With the safety, with the side effects, you have that surveillance system exactly to find these safety signals. So there is a lot of questions. I mean, this raises a lot of questions, both to the people in charge of, the different vaccine mandates, and but also to Pfizer, of course, and to the politicians, because in the end, you may argue that the politicians, the regulators, the authorities haven't been, enough on the tip of their toes to look at these side effects and to find out why did something change along the way. And I think it's very interesting because I saw at one point that the vice president for Pfizer said, I think it was an article in Nature, and she said, well, we are building the airplane while we are flying. And I'm like, I hate flying, but I prefer, the airplane to be built before flying. And it makes sense when you see these different graphs.
So we want reassurances from Pfizer that they did not become aware of these high adverse reaction rates and change their formulation as a response to that without informing anyone. We're not saying that happened, of course not, but we would like reassurances from Pfizer that that did not happen.
I think Pfizer has an issue here to give us some answers. And I think it's very interesting that this study has been out from, was it mid-April? And of course, Pfizer may be the first one to realize or reckon when there's a new study. And I think it's quite interesting that Pfizer hasn't been out commenting on this study, which for me is like they know that this is a kind of the maybe even worse, you wouldn't know, but I think they know that that's how it is, and probably also wise to do that. On your way, if you find out there's many more side effects, of course it's a proper way to do it, that you change the product, but you need to inform the public, you need to inform the customer, the patients, the citizens, and so on. So it's not that I'm saying that it was bad to change a product which is if it obviously has too many side effects compared to the others, that seems wise. But you need to have the information. You need to have that information given to every part in the line, and that hasn't been the case. And then also, this doesn't show anything about the efficacy. I mean, the next thing is, if they change the product, what it seems like they did, or if they change the product, logistic, the transportation and all that, well, did it actually work? I mean, then you're back to, well, was there any, reason of getting the vaccines? Did it? We know that it didn't do anything to transmission. We know that there was the vaccine breakthrough. We know from Danish data, at least, that from what we could see from the Danish data was that people getting vaccinated actually did have more breakthrough corona incidents. So one is, was it worth the trouble, so to speak? Was it worth the side effects?
And if I'm not saying the vaccine was changed, but if the vaccine was changed, the efficacy data was taken on the original blue doses of vaccine.
Exactly, and there you go. And then again, and what on which purpose or on which premises did they actually get the emergency authorization? That's the next question. Well, one thing is, how did they get the emergency authorization to go on the market? And the next thing is, how and when and why did they change the product on their way? Again, I'm not saying they're doing that, because we can just show a pattern which shows that this is a product problem. There's something with the product, whether it's the product by itself, as I said, the transportation, the distribution, whatever, but there is a product problem with that product. That's obvious.
We want reassurances that this didn't happen from Pfizer.
Or if it happened, why didn't they tell the public?
Yep.
Why wasn't the patients told, and so on? That's a
the,
basic part.
Yeah, and the regulatory authorities, why didn't they tell us?
Exactly. And why didn't the regulators see this signaling? They were supposed to find it.
If I had seen that graph before I was vaccinated, there is no way I would have accepted that vaccine.
No, well, I would have gone for the yellow line. I would say exactly. I would have.
I would have accepted the yellow line.
Exactly. I would have said, okay, give me the yellow one.
I wouldn't accept the green line. That's way higher than acceptable. But the blue line is just outrageous.
And that is the problem. And the problem is also, and people of course get frightened by this, because the people who was pushed to get the vaccines was actually the health professionals. Several places, I just saw a study from UK, where you had the vaccine mandate literally, for health professionals. And so people were pushed into these vaccines. It was not like
people were certainly pushed. I don't think it was mandated, but they were pushed.
No, but mandating is also, you can't go on your job. You're not supposed to come. I will, mock you and not mock
That's
you.
True. A lot of care workers lost their jobs.
They lost their jobs and they were bullied, and there's so many ways of nudging or
correct.
Putting pressure. I say this is the nudging project of this project of the century, because you nudge it literally all health professionals, or more or less all health professionals, to get these vaccines, and that was actually in the beginning. So lots of people, of course, may sit back and wonder, well, what happened? Was this dangerous? And what will happen in the future? Because now we know that these were the side effects, being reported while there was a close historical or time, between those. But the next thing is, of course, let's say you have someone, I'm not saying that this will be a side effect, but let's say there was a risk of getting cancer early, or having, or heart diseases later on, like we know with myocarditis, but, other sorts. And of course, and we know also that if someone gets, let's say, cancer later on, there's a much less chance that it will be reported as a side effect. But of course, people will wonder and worry, well, could that be the case, and so on. And that's why the next data we will look into and try and have published, of course, is all-cause mortality.
Because bless you. That really needs done. Yes. Really needs done, Vibeke. Yes. Yeah. So most of these blue vaccines were given before April 2021, we think, most of them.
Yes.
So we've said that most of the blue doses were before April 2021.
Yes.
So that
seems so. We didn't publish that, but from the numbers or the data we had afterwards, yes.
Yeah. Now, the other trend we notice on this graph, Vibeke, is the classic positive correlation. What we find is that the vaccines that had, for example, here where we've got this one, we've got a higher number of vaccines per batch are associated with a higher number of side effects. It's almost as if there was more side effects associated with larger batches and less side effects associated with smaller batches, almost as if there was some problem with the quality of the higher batch production than the lower batch production. What do we make of this?
We have talked about that, but it would be difficult. You can see from the line yourself, you're right about that. But saying so, we haven't got that much into that. And that is the thing also. For us, it has been important to say, what can we show and what can we reckon from that? Yeah. Because our study is just a small part of a big puzzle. So therefore, we tend to say we shouldn't speculate too much. We can just say that's what we see, and we see that there's too huge a difference between the three lines. But whether to go and see, well, the bigger batches or the smaller batches, then we tend to be speculative, and then we should do some other analysis also. So I would, I would prefer not to say this or that on that matter, because we haven't been looking that much to that. We have been so much aware of the problem by itself, the signaling, been so much focusing on, try and look at the numbers. Were we wrong? Were we right? And try and do this and that. And I think that is the main part we can say for now, that there is a safety signal. But saying, well, whether it was, which could be right, it was the bigger batches or the smaller batches being a problem. Well, then again, that could be the explanation from Pfizer if they want to give any explanation, or that's all the sorts of things which we should get an answer to, because this raises a lot of questions in many levels, literally, as I said before, not only Pfizer, but the regulators, politicians. How much have they been following these numbers? How much have they been aware of their, their responsibility toward the public, the citizens, and all sorts of questions, really.
We'll leave it there, but I can see that the right-hand side of those lines, the blue line and the green line, is higher than the left-hand side of those lines.
Exactly, you can tell. So, but you got a point. But I'm just saying that we haven't, done much more about it, because you're right, and you can see that from the graph also.
So I accept that. Now, to what degree does this Danish data apply to the rest of the world? Were these batches that we were getting in Denmark the same as the batches we were getting in the UK and
it should be some of them, yes. There was, like, the world were divided. You had the States, where you have one kind, part of the production, and then you had Europe, and probably also Asia. I'm not that much into what happened in Asia, but we know for sure that these batches has been used in Europe. And Brexit or not, I suppose you're still a part of Europe. So
geographically, for sure.
Yes, I'm quite sure that some of them may have been used in UK also. Right. And we know that we have had people from New Zealand recognizing some of the batch numbers, but we're not sure that they were giving in New Zealand, but it could be New Zealand being maybe in Brussels or Paris, but there will be people all over the world who for some odd reason have had these batches.
So why haven't the regulatory authorities in the United Kingdom, France, Germany, Italy, Spain, whichever country you want to mention, come up with this data? And the other thing is, why the heck is this? I know you're an academic. You've worked sacrificially to get this data, Vibeke.
Yes. Yeah.
And on behalf of the world, thank you. We really appreciate this. Why wasn't this done?
It's been a hard struggle, I must say. It's been a hard struggle.
I know you've worked flat out. You've been working flat out. I'm aware of that. Why didn't the Danish Why do you have to do this? Why didn't the Danish regulatory authorities do this?
Well, I think it's the same problem which we have had all over the place, that you have had like a narrative. You have had like, you are not supposed to be critic against the vaccines. You are not supposed to be critic against the lockdowns and the mask mandates and all that. I think some of it has been this huge amount of censorship, which we also felt, because we actually tried to have this, study published in all four big, journals: New England Journal of Medicine, JAMA, The Lancet, Archives of Internal Medicines, the four big ones. We tried to have this study because we thought this is like finding the, with all respect, but, the answer to cancer. I mean, this, for us, this was seems like the public are aware of that this was so big news. So it should be and ought to be in one of the big four journals, and they didn't even send it for peer review. They just, I think it was New England Journal of Medicine, literally within 2 hours, the chief editor said, no, thank you. And I think that is part of it, the censorship. Yeah. We haven't had that transparent discussion, and I'm now happy because people discuss this, could that be this and that, and I'm just saying I'm so happy because we need that discussion, and it's so unscientific not to have a discussion, a debate, and that has been, you could say, illegal, illegal for the last 3.5 years now, that you are supposed just to grab the narrative or other stay put and stay quiet. So I think that's part of it. So like everyone has been going into that narrative, oh no, 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 there couldn't be any problems. No, no, for sure. And while, we can see from the data that there was something to worry about.
Yeah.
So I just wish that this could open the debate we have been lacking this last 3.5 years.
Yeah.
Yes. And I'm happy if people find something else which we overlooked.
Of course. So the Journal of the American Medical Association turned you down.
Yes.
The New England Journal of Medicine turned you down.
Yes.
Which other journals turned you
and
down?
And the Lancet and Archives of Internal Medicine.
Lancet turned you down, and Archives of Internal Medicine.
Yes.
I have a question. I have a question for the editors of JAMA, New England Journal of Medicine, Lancet, and Archives of Internal Medicine. Can you tell us what was wrong with Vibeke's science, please? Because I've read this paper, and to me, it's a good scientific paper. We need. Did they give you a rationale as to why this paper was refused?
No, and that is also the thing, because you have this peer review process, which this was through also, and they didn't even send it for peer review. So this was like the chief editor who decided, no, this is not something for us, and they just gave us, like a blunt, just a blunt talk about there was so much interesting studies coming in. So unfortunately, no, thank you. But this was literally within hours and few days that they decided. I could understand if they had sent it for peer review and the peers said, oh no, it's no good. But this is actually a very excellent and a very through work study. So I'm very proud of it, because I think it's well written and everything. So it's like, if they had sent it for peer review, then I would have accepted that. Okay, fair enough. But they didn't, and that's the only word I can get into my head is censorship. But that's also because, as you can see in the public, in the mainstream media, we have not been allowed to have this discussion. We have not been allowed to raise concerns about safety issues with the vaccines. If we did so, we were called names, bullied, and so on. So I think that's part of the sickness, so to speak, or that you are not supposed to talk or speak against the narrative.
Yeah. So JAMA, Journal of the American Medical Association, New England Journal of Medicine, Lancet, and Archives of Internal Medicine didn't even send this for peer review.
Oh no, none of them. It was just the chief editor who said no, thank you.
So one man or woman said, no, off you go.
Off you go, exactly. And of course it was very frustrating, because we knew that this was important. You could put it another way. We started almost a year ago, and I'm so grateful that this medical journal had the courage to publish it, and they sent it proper to peer review, and we had a proper nice scientific discussion, and it's just been a nice process. But of course it's sad, because then it could have been publicly known beforehand. Also.
This has taken a long time. So congratulations to the European Journal of Clinical Investigation.
Yes, exactly.
Questions for the other big four, serious questions. Because if they're deciding what medical information we get and what medical information we do not get, then that is an absolutely fundamental problem with all medical epistemology. It's just
it is, and also
fundamental.
It is, and also again the transparency.
Yeah.
I have been very much eager to get transparency also within the media. You could say the medical journal. What are they, rejecting? What are they, also with how come this hasn't been in the mainstream media? How come that the mainstream media, BBC, you could say, this is such an important, knowledge, new knowledge. How come it hasn't been out to the public? What are the procedures? Who are they, taking care of? Seems not to be the public. And that's why I keep saying transparency, because that's literally what we need.
And the other thing to remember here, of course, is that not all of the adverse reactions are reported, because sometimes people will have the injection and have some adverse reaction but not realize it's connected.
No, exactly. And we know that there's a massive underreporting in this, both if it's old and fragile, why would you go? They are sick and what could it be? But also the other way around, because, and that's why I'm saying that there needs to be like a very short time, time difference from when you have the vaccination and you do the reporting, because as longer as it gets from when you had the vaccination, the less the possibility is that you will report it as a side adverse effect, even though it is a side effect. So you're right. This is like just the tip of the iceberg, and even more now, because now it's less obvious that people will. Let's say some of the people who got the blue badges. Um, as I said, got cancer and, in a young age, or sudden death, or, have something with the heart, whatever. Very few will report it as a side effect to a vaccination they had for, now it's 2 years, more than 2 years ago, So, and that's why, I'm eager to look into the numbers. I see that you have in UK, very high amount of heart death and heart sickness, and that could be many explanations. We have excess mortality. You have that huge excess mortality. We have that in Denmark. Of course, one wonder whether some of it is partly because of the vaccination. I don't think that is the sole explanation, but it's difficult to not reckon or think that there could be some kind of a combination. But I also think that excess mortality is has something to do with lockdowns, because the patients were getting the diagnosis, the treatment, the rehab much too late because they stayed home. We know that from studies with the heart, that some of the people who had like ischemic heart disease, they wouldn't go to the hospital, so the heart was more damage because of they didn't get the treatment, which will in the end cost you life earlier. So I think it, but then again, if we in any ways could look into the data and see a difference, you have that advantage in UK, that you get the numbers of people having heart diseases, cancer, and so on. Unfortunately, the Danish databases are not that much updated, so we get the numbers like 1 or 2 years later. So we still haven't had those numbers, because of course that would be obvious also to see, will some of the people who had the blue badges get more cancer than the green ones. But that's speculative again, but I'm saying that this opens up for a lot of other kind of science into these data.
Yeah. Now, the other factor that's occurred to me here, Vibeke, and we don't have to put this in the final recording, but Professor Niels Høiby in Denmark, he advised the government to change the protocol on vaccination. And I think he did that about mid-2021. So after mid-2021, they were in Denmark, they were sticking the needle in and giving aspiration.
Oh yeah.
To prevent intravascular administration. So it could it be that the blue doses were given largely by nurses and doctors without aspirating the injection, thereby giving more intravascular injections? And after that, after Niels Høiby had intervened, around about, we think about mid-2021, that the green and the yellow doses were given with aspiration. Therefore, there was less cases of intravascular administration.
Well, could be, and that is why I'm saying I think this is like, it could be multifactorial, really. That one thing is the way of distributing the vaccine, another is the transportation. Did they, do too much? The cold chain, why shouldn't it be minus 70 degrees? And again, the product. And that's why we're saying, we can literally say whether it's the product by itself, what's in the small bottle, whether it's the transportation, whether it's the way of giving it to the patient, or whether it's all four parts, which is, but nevertheless, there's a problem. And that's why we're saying that this is a product issue, whether it's the product by itself or how you distribute or how you give it to the patient. But that's all what we will think about, and that's why I keep saying we need to give these questions to Pfizer.
Yeah.
But because I think we as a public, as the world, we need to, we have a need or a demand, so to speak, to get these questions answered, because now it's just you think it may be this, I think it may be that, and but we need to put the questions to the right people, and whether it should be you and I or the authorities. I think the authorities should ask these questions also, the one who asked for the products and who bought the products. What is the problem? Because it's not funny, but any other product, where you see that there's side effects, too many side effects to one batch, it could be heart medicine or whatever, the medical agency will take it away from market straight away. So the regulatories are very tough, and that's why I don't understand why the medical agencies haven't been, as I said, on the tip of their toes to look into this and to react and to demand an answer and maybe halt the vaccination and so on, because something may have happened, as you also could see along the line. So let's say they realized, let's say mid-21, that there was too many reported side effects. And let's say Pfizer said, well, sorry, we did put something wrong, or we shouldn't do, or you shouldn't vaccinate like that, you need to do it another way, whatever. Then, of course, the public needed to know that we have had an issue, we have had a safety problem, or halt the vaccination. Again, all I'm asking for is transparency, that you will tell the public, hold a second, let's see, we have an issue here. But nothing happened. You just kept, going on. You just kept vaccinating people, children in the States, So that's the problem,
Vibeke, on behalf of everyone in the world, really, to you and your colleagues for all the work you put into this, thank you so much.
Thank you.
And also thank you for coming on this video and talking about it. We really appreciate it. So bless you and your co-workers in Denmark for everything you've done.
Thank you, and thank you for being on the show. I think you're doing a splendid, a very important work to have this to other, in the world. So I'm very grateful to be part of it. So Thank you very much.
Thank you, Vibeke.
Thank you.